All right, guys, thanks everyone for being here today. We're going to go ahead and start our CSAB EMS meeting. I just want to start off by kind of explaining the way our committee is laid out. We have 13 regions that make up our committee. 8 of them are with the districts in the county, the fire regions. And then we also have representation from Cleveland, County Board of Health, Center for Health Affairs, and 2 positions opened up on the regional hospital systems. So we do have primary voting members, and then we also have alternates as well. So even though we have good attendance so far, some of the members are alternates to the primary members, which are here today. So hopefully we get one more person on, and we could officially have a quorum, which is 7 voting members. And that's all spelled out in our bylaws. We have no education or presentations today. For the chair report, I just do want to discuss a minute meeting attendance. I know we're all getting pulled in all different directions, trying to keep our community safe and COVID and meetings here, meetings there, and it's hard to sometimes keep track of all these different meetings. That said, we haven't been able to have a quorum for some time on this committee, and I'm just kind of looking for maybe some guidelines or some ideas is how we could improve some quorum. I will be reaching out to some of the regions that have been a little bit not participating for whatever reason, and see if there's a problem with some of the members we have. I know we lost a little bit. For example, Dave Miller from Cleveland EMS regularly participated in these meetings, and he since retired. So we're down a member from EMS. So I got to reach out to Nicole and see if she can assign somebody, to replace him. But Nicole is been invited, but she's busy as well. So, for years I've been involved in this EMS committee since I became chief in 2011. It's always been a 2 o'clock meeting, Mondays like this. That just I just kept on that same schedule, and we've always had pretty decent participation up until recently. So if we need to change the time, the day, I would be open to that. Just need some feedback from you guys on what you would like me to do moving forward. Just, so I want to make this meeting worth all of our time to be here. So anybody have any suggestions or input on meetings?
You know what, Bruce, this is Bill. I would suggest maybe not holding them on Mondays. Mondays seem to be a pretty busy day for a lot of people. I know I myself, I have payroll to do, which is consuming standing meetings on Monday. So just my 2 cents.
Yeah. Any other suggestions or input? Okay. So I'll consider that. I'll reach out to the committee as a whole and see maybe with the survey and see what day, what time might work best. Also, see if we need to get reassignments of various voting members. Maybe there's been changes within our organization and they're not able to participate like they once did. So we'll reach out and hopefully we can get this meeting a little bit better attended. We have no public comment today. For the approval of the minutes, I don't look like anybody else popped on. So we still need to approve the minutes of March 9th of 2020. But that was the last approved meeting that we had where there was a quorum. We took, as you remember, we took some time off due to COVID. We started back meetings again on November 9th. We didn't have a quorum, so since there was no quorum, it's technically not a meeting. Same with January 11th. So, and same with today if we don't get somebody else on here. But we do have a good group of people on here today. You know, I see 18 people, so we got some good participants within the meeting today, which is good. So I'd like to start down our reports of office, starting with the Office of Emergency Management. So open for Kevin or anybody else from EMA to give a little bit of an update what's going on in their office.
Yeah, so good afternoon, everyone. We are continuing to work with the Board of Health on these vaccination clinics, as well as the state on the megapod that will be coming to Cleveland for 8 weeks, starting, I believe, March 16th. Ohio did just lower the age to 50 for vaccination for people that are eligible. However, we still have approximately 50,000 people on our wait list that fall into phase 1A, 1B, 1C that we are working through. Other than that, that's pretty much what we're working on, other than starting the hazard mitigation plan update, which we'll be reaching out for input on, and the resource distribution stuff that we've been doing and living for the last year.
Kevin, in regards to that megapod, if you will, what is going to be, is that going to be a Cleveland thing or a county thing? I mean, or should we expect some kind of, or is the National Guard involved? Should the fire departments and EMS agencies expect a phone call asking for help, or what? Can you give us any input on what?
Yeah, so it is a state thing with City of Cleveland support for, or at least they're asking for City of Cleveland support for traffic control, et cetera, in and around the area. It is mostly going to be staffed by state resources, including National Guard, Ohio State Highway Patrol, et cetera. It's really the local involvement is going to be messaging and outreach and getting people to sign up via the state's registration system. I believe they also have reached out to a couple of the hospital systems for potentially some pharmacy support. But other than that, it's pretty much a state-run program.
Well, obviously, this is it's not a drive-in per se, and how many people are they looking to vaccinate a day? Was it like 6,000 or something like that?
It's supposed to be 6,000 people per day for 8 weeks, and with some of those appointments each day being reserved for hard-to-reach populations and underserved populations.
And last question with that, would folks or residents, if they start asking about that, would that be signed up through the state portal that DeWine's been talking about? Is that, you know, or is that going to be a different sign-up process in that?
It should be via the state's new portal that they're finalizing. The front-facing portion did go live today. However, they are still working out, I guess, some of the kinks before it actually starts scheduling for these megapods. Right now, the only things listed on there are other providers in the area that are giving vaccine. So,
Okay. Does anybody have any questions for Kevin or regarding emergency management?
This is Tom. I'll echo what Kevin said about the megapod. That's what we're hearing from Cleveland as well. That right now, minimal support from the local municipality. But with that said, stay tuned. Things change.
Support for the EMS charts is all new policy. Is
Yeah, if you guys hear any different, feel free to reach out. I'm sure we have some support. But I haven't heard nothing, so I assumed it would be done by state or National Guard or something like that. So, thanks for that input, Kevin, and your input, Dr. Collins. And we're going to move on to grants, which I see Larry and Leslie are both on. If you guys can give a report on grants, I would appreciate it.
I'm happy to, you can hear me, right? I just make sure my microphone works. All right. So as far as the grants are concerned, mass casualty trailer supplies, I know you, Bruce, you were working with Linda on that. The purchase order was approved today, or was on the Board of Control today for approval. So within the next day or two, we should be able to produce the purchase order and send it to the vendor, Kentron, excuse me, and work at. I didn't see where the delivery is, but it's probably worked out between you guys and the vendor. Let's see. And then we should be, right now, there aren't any other projects, at least for emergency management or for EMS. But the 21 grant should be coming out this spring, and we'll be working to see what that situation is. I don't know if Leslie has anything more up to date on the pending grant.
No additional information on that. I was going to share that, yeah, the mass casualty was approved at Board of Control today. They didn't have any questions or anything. And then I think, I don't know if this group knows that the FY20 grant was approved by the state as far as our application was officially approved earlier this year. And then like Larry said, we expect the FY21 any day now. I think that's all I have, unless anyone had any questions about specific projects.
No, with our committee, obviously the mass trailer supplies have, we've been waiting on, so we're glad to hear that. I'll have to reach out to Linda to see, because I don't recall us having a discussion on where those items will be delivered. Hopefully she's having it delivered here, so if not, I'll have to make arrangements to get those, I guess. For anyway, I guess I could work that out with her. And then once I receive them, I could work with the different EMA agencies in Region 2 to make sure they get their supplies and all those types of things. So, and it is true that Cleveland did not make the UASC cutoff. Is that correct, Larry or Linda or Leslie?
That
Yes.
is correct. Yeah.
Okay.
Yep.
So I know there was a number of us hoping that Cleveland was going to be designated a UASC site again. We haven't been a UASC approved city in a couple of years now, so that would have been nice, but it is what it is. So, any questions for Larry or Leslie?
I'll make sure, Bruce, about the delivery. If you're looking for it to come to Mayfield,
Yeah.
I'll check with Linda to make sure that that's the delivery location, and she can work that out with the vendor.
Okay. Thank you.
All right, and then we'll keep you up to date on. We'll make sure the vendor gives us a heads up so that stuff's coming.
Okay.
Okay.
Thanks again.
Yeah.
We're going to move on down to Cleveland EMS and Cleveland Airport. So Dr. Collins can give a report on EMS.
Thanks, Chief. EMS, Cleveland EMS volumes are still off approximately 4 to 5% compared to last year. Opioid and trauma issues have leveled off a little bit. We're getting ready to hire a new class of paramedics, and then Cleveland EMS will be starting a new EMT class, so hiring civilians that will train as EMTs, and then they can become paramedics. Cleveland Fire is getting ready to start a class of 80. They'll be trained as EMTs as well. Other than that, we've deployed the new Northeast Ohio regional protocols. We're in a 4-week blend phase where we're phasing out the old protocols and allowing people to also use the new protocols. And so far, things are going very smoothly. Knock on wood. That's all I got.
Thank you. That was a big project for Cleveland to take on, and I know it's been years in the works, and so I appreciate you working with Cleveland to implement such a big protocol. I know that there was a training nightmare for some of your folks, and hopefully they found it a good document to use, and we appreciate a lot of their feedback in regards to some of the items that they found that needed to be corrected. So they've been participating in the process as well.
CSAB meeting.
Okay. Frank's gonna rewrite those numbers to include Burke trucks and building maintenance trucks. Eric was at lunch, Frank was at lunch, I put them together. Frank's trying to be cheap. Eric told the same things we've been telling these guys.
All right. Yeah. Yep.
The only thing I had that came up other than I hate Brian Valletto. We were teasing him in the training room a little
Is that
bit.
Larry with an open mic?
And it's Chief Davis. Yeah.
Chief Davis? Okay.
He's off now, so. Chief Davis, you have a report for Cleveland Airport? You can always come back to it if you can.
Yeah, no, everything's going good
Okay.
here. Yeah. Our drill tentatively this year is going to be scheduled for in September the 21st. That's a tentative date we have right now.
Okay.
The triennial drill. So there's going to be planning meetings. They're all being virtual right now, but he's sending out the invitations via, Zoom and everything in smaller groups. So that'll be forthcoming throughout until September.
Okay.
Other than that, nothing else.
Chief Davis, I'm not sure if I'm the contact for CCOMs or if you have Sean Smith as the contact, but Sean Smith has since moved on to bigger and better things.
Okay.
So that I get those meeting invites, I'll make sure to attend.
I think you still have you as a contact as well.
You do? Okay, perfect. Great.
I'm
Thank
like
you.
90% sure.
Okay, cool.
But I'll
Thank
double
you.
check. All right.
Okay.
You're welcome. All right, bye-bye. That's it for me.
All right, sir. Any questions for EMS or airport? All right. Center for Health Affairs, do we have anybody? Thought I saw Andrea did. Yep.
Yeah, I'm on. Hi, everybody. How are you? We've been working mostly to supporting public health and hospitals with their vaccine efforts. And Beth wanted me to make sure that I extended a huge kudos to all the firemen we've seen helping with the vaccinations, as well as we're trying to do this scramble to get as many shots and arms as quickly as possible. So thanks for that. We did hold, it was a grant deliverable of ours. We had to create a burn surge annex to our coalition response plan. And the intent of the annex was to supplement the local hospital surge plans, as well as the local county MCI plans, if there was a burn mass casualty incident, and how we would do the coordination with that. We actually had the scene in Ashtabula because that would be a big challenge with travel and things like that. We tried to see if we could identify and find some solutions to gaps for the transport and the patient distribution in that. So we did that. There was 52 people that attended. It was a virtual and it's just kind of like Cuyahoga County does with CCOMS's role in mass casualty, how they help and assist with the patient distribution. We're kind of talking about we needed a little bit more of like a role in the middle, because we went through everybody's roles, but in Ashtabula County, they don't have a CCOMS to do that kind of stuff. So we're discussing how we could build that out, maybe use the hospital transfer center somehow to fill that middle of the role. Somebody said the 1,500,000 view. The intent is to make the scene safe, make the patients safe, get them to the facilities, and then from there, try to figure out who needs a burn bed, and it involves using OSU, the Michigan, and a big, huge state response then, because our the burn unit, the burn center beds are specific and limited. So so it was a lot of good conversation. Some other things that kind of came up is on like almost every other slide, it seemed like ODH wanted to know who does the OH track incident, who keeps the tracking, who does this, who does that. And I know it's a system that we don't use on a daily basis, so it's kind of gotten a little bit fallen back. And I know we haven't done, the last time we did a drill was in advance of the presidential debate. So, but I think it's something that's really important for visibility, especially if Ohio State University was kind of looking at our list of patients and things just for situational awareness on a large scale event. So what I thought would be probably be best that I want to move forward with this is figure out, we have 5 counties in our region, and we've got 12 months in a year. So have each county do a drill twice a year and just make the incident and the drill, keep it open for 3 days. People can practice on it just to kind of keep familiarity, keep accounts open, and do that. So I'm going to reach out to Jackie and see when she would like to, what months she would like to pick the drill. I don't know if you want to do it, Chief Davis, if you would like to do like September would be one of your months. Then we could use the exercise as the date, or if we would need to do it in advance of that. But just to kind of keep things on the forefront, and that. So, and I think that's all I have. We're still working from home. Our office is still closed till end of June. So, but we're all still working. Good thing.
Andrea, I got a question with your burn surge annex. Is that something that needs to be possibly added to our MCI annex for the county, or up?
You guys already have, the Cuyahoga County has an MCI, and then I know on the protocols, because I worked with Beth and I and Tracy Pate, as well as with Monica Oka and Gigi Hubbard from Metro Health, worked on using the template that ODH provided on developing the burn surge annex. And then we also had Dr. Yowler and his team review it before we wrote the draft up. The draft was due in November. We had to submit that as deliverable, and then tabletop was test the draft. So we're going to be making some changes to it based on the discussion at the tabletop. The exercise design committee is looking at it till the 19th of March, and then we have to pose it to the executive committee. So then it's up to you as a county whether you want to incorporate. At least there should be an awareness of the plan, that it does exist, and it's just to kind of help take it to another level. So I don't know how much you want to add to it. I know Cuyahoga County has a bit in there. Your burn specific information is in your mass casualty part of your protocols, because I looked in all the county MCI plans in preparation for when we made our annex. So a lot of them have, like, I think the rule of 9s and that kind of stuff in there. And some of in the Ashtabula, they just specifically said if it was a burn to the hand or genitals, they go to the burn center. But that's not always, when you have 300 victims, it's a little bit harder than that. Some of the one, So more to come. It's up to you whether you want to incorporate parts of it, at least have an awareness that it does exist to go up a level. We do have to do these specialty plans every year for this grant period. So the first one was pediatrics, and the same kind of thing. This year was burns. Next year is infectious disease, which we've been living. And then from that, then after that is chemical and radiation. So those are coming up.
Well, we haven't, we try to update our MCI plan every few years, and it is coming up on 2 years this October. So I don't recall seeing anything in burns in that particular section, but we can work together and you know, we need to update that anyways. Even if we say that no changes are needed, at least we showed that we looked through it, we acknowledge a change or not a change, and then we can give it to county to approve, and then it could go to me, you know, for their, because they have to update their records too. Yeah, the last change was 10/19, so so this fall we'll take a look at it, and if we need to add something, we can. If it's fine, then it's fine. So.
Okay. Yeah, we have the regional plan, and then the state developed a plan because they identified Metro Health and Ohio State University as coordinating centers to try to help with basically support. I think Metro Health is supposed to take the upper half. It's still kind of being flushed out from the tabletops because every region has to do a tabletop, and there's just 3 that have completed them so far. So based on what they come out with that, but we think that Metro Health is just to take the upper 40, whatever, I forget what Regent Seymour always says. And then the lower would be so that, like, if there was an incident in Southern Ohio, that Metro Health would help support OSU with the patients. We're fortunate here. What did come out is we do have access to a lot of subject matter experts to assist with that care of burns. So utilizing telehealth and that. So we'll see what happens. But yeah,
Okay.
I'll let you know.
And then we can put together a small subcommittee to review that, regardless if we had burns or not, we still have to review it. So we'll get a group together, just, you know, 3 or 4 people to take a look at and update it. And well, if we need to add something, we will. So that's a good time to do it. So.
Okay. All right.
I know that Rebecca and Heidi's not here today. I know, just being very involved with the vaccination process. I know I worked at the clinic last Wednesday, and I think that they were looking to push about 12 to 1,300 people through that site. So the programs have been very successful. They're trying to get less and less EMS folks and trying to reach out more to the healthcare field. And I did see a big difference. There was only a handful of EMS. They're kind of giving us a little bit of a break because we've been involved in that from the very beginning. So, so they're reaching out a little bit deeper in our pool to get some help with that. So, you know, Fire and EMS continue to support their operation when needed, and it's been very successful. So, thank you to all those folks that have offered up assistance or approved assistance to help in these sites.
Yeah, there's a lot of people doing little here's and there's, and every little bit helps. So, and that megapod, when that starts, that should help as well. So hopefully we'll get back to semi-normal life, I guess. Okay, thank you.
Okay, thanks. Jackie, what do you have to tell us about CCOMs? Any report?
Well, with CCOMs, we're looking to hire some call takers. We're establishing an eligibility list for call takers. So we just made a recommendation of, I think, 5 or 6, and we're looking for 7. So if anybody knows anybody that would be great at 911 call taking, send them our way. We also just finished interviewing supervisors. So I'm really looking forward to the supervisor filling out, because that's what's been holding me back on a lot of my admin stuff. So it'll be nice when that person comes on. Now that I've started to get a little more time, I am picking back up the pace for the EMD project. And as far as the EMS protocol goes, like Dr. Collins said, our 2021 revision is out. It's posted up on the website. I just want to remind everyone about a link for feedback that is also up on our website. Through the protocol and you see something, have a question, have a comment, please feel free to provide that feedback. We do review it and we do follow up with you. And that's all I got.
Just to follow up a little bit more on the protocol, and we just put out the protocol within a few weeks, and we're already talking about some updates for the next time. So this group is outstanding to work with. We already found a few things that we want to work on for the next revision, which will be rolled out around January of next year. We're looking to only do annual revisions unless it's something that it jeopardizes patient safety or something that just needs to happen now. We have flexibility of doing that. But we've already found some typos. We already have some protocols that we're working on for next time, and looking at meds and so the group's committed to having an outstanding product out. And so kudos to Jackie and Dr. Collins and all the other doctors that have been working on this over the last few years. I think we're finally starting to get a good feel for this and working together as a cohesive unit. So I appreciate all your work on that. Any other questions for Jackie on protocol updates or just general CCOM updates? Okay. Todd, I see you're on. What can you tell us about NOTS? Any update with NOTS?
Sure. NOTS is one of the missions that NOTS had, and I know I talked to the Cuyahoga County chiefs, and we've hit some other county chiefs, was a one-call system. And a couple things. First, the big one is we are moving forward with the one-call system. Our board reviewed the process that we've gone through. We've identified a vendor that is involved in aeromedical, and I know it's less impactful for Cuyahoga County, but it's significant for the region. And that is essentially pre-hospital calls will go to one phone number. That number is going to have a CAD system that has geolocations of all the helicopters. And the goal is that when you call for a helicopter, the closest available asset will be dispatched regardless of what color it is. It sounds simple, but it's been a painstaking process of over, I know Chief Elliott, you were involved in the EMS committee. We've been talking about this for 2 years. The goal is going to be have this up, running, and implemented. We're using a software, CAD software called Flight Vector. It's what they do. This is will be the first place anywhere that we can identify that has 3 private systems that are collaborating together to make sure that EMS gets the resource as quickly as it can. And it's only going to be for pre-hospital, but I think it's a big first step. And the only other thing I have to report is there was a decision made that the NOTS Symposium will be virtual again in 2021. We'll be getting information out. Unfortunately, there was just too big of a financial commitment to make with uncertainty as to whether we'll ever resume what we had in the past. So instead of risking $50,000 or $60,000, they took the option of making it virtual. So I'll get this group some information on the save the date and the speakers. Other than that, that's all I have. Education's still available. Folks need it.
Todd, with the one call system, what about, like, say your neck of the woods out in Madison? Would it look at, say, Erie and as an option, or is it just dealing just with the hospital systems in Cleveland?
So what it's doing right now from the aeromedical is just looking at Metro, Cleveland Clinic, and UH. So it's just which is 7 helicopters, I believe it is. So yeah, it's probably less impactful for Mayfield Heights, who's got, Hillcrest right down the street, but it's a big deal for the region. And the other thing was getting NOTS to look beyond Cuyahoga County for what we're trying to do. At some point, it may end up being like a stat medevac, but it was a big enough challenge with the 3.
Yeah. So is Cleveland Clinic doing scene runs then?
They will be available for scene runs, yes. Essentially, the way the system is going to work, each provider or each aircraft puts itself either in or out of service. So that if you think about, the CAD system, the officer is either involved in an incident and not available, or he is available. So essentially, they'll all make themselves available. If they have a flight that's takes them out of service, they'll be removed from the system so that they're not an option. And one of the things that we identified is, and I'm not picking on a system specific, but everybody needs flights to keep the program viable. So instead of you calling system A and their closest aircraft isn't available, so they called their second aircraft, which like for me would be Medina, for instance. This is going to kind of force the call to go to system B, who might be at Burke. And it'll hopefully help eliminate delays. One of the things that we're going to do is probably do a study in an abstract once it's done. And with the NOTS database, we're going to try to look to see if time to tertiary care is positively impacted.
Todd, if you don't want to answer this question, please just tell me no. Has there been any consideration to standardizing costs for depending on who you call?
So no, at this point, no, because several people just realized, I don't think that some of the people understood that that was a factor in some of the decision making. But I think that that's something that's going to be brought to the table. The problem is you have nonprofit and for-profit organizations that are collaborating. So we haven't peeled that layer.
Okay. Any questions?
You know way too much, Bruce.
Well, I just saw that smirk, so I just was laughing to myself. Any questions for Todd in regards to NOTS or the one call system or anything? Well, Todd, I've always been in support of the one call system, and I think it's the right thing to do, and I'm looking forward to seeing how it works and rolling that out. And I think it's going to be a huge benefit to us out there in the field. So, instead of worrying about who has to call it, when and how, and see one number we can call and we're going to get help as quickly as possible. So I think we're going to find out that's going to be a huge benefit to us moving forward. And that's what NOTS is all about, trying to standardize care and do what's best for the patient. And that's what this is boiling down to. So that's going to be a good thing.
We'll leave on that note.
All right, we're going to move on to old business. Larry and Leslie kind of talked a little bit about the MCI trailers, so I don't really need to talk about that much. So supplies are being ordered. I will be working with the different counties and updating their equipment, and so that's good news that we're moving forward on that project. Great. Any other old business that anybody would like to discuss? Moving on to new business, I want to move backwards a little bit. We do have a couple more people that came into the meeting, so we actually do have a quorum as we speak. So I will move on to the minutes here in a little bit. But as the bylaws state, we do have the chair position is always on even numbered years, and then the vice chair is on odd numbered years. So we always have, every year we have somebody to vote in to fill these roles as chair and vice chair. So we do have a vice chair position open. We talked a little bit about it at the last meeting. I put out some feelers out there to see if there was any interest in it. Really haven't had office. But I did reach out to Chief Mound from Brook Park, and he's been an advocate at EMS his whole career. And he said as long as he's still on a job, he would be interested in it. So he is our current vice chair. I would like to nominate Chief Tom Mound from Brook Park for the vice chair position. Tom, would you be open for that position?
Can you hear me?
Yes, Tom.
Okay, yeah, like I said, I'd be willing to serve. I would hope somebody would be interested in taking my slot. I'm getting a little long in the tooth, and I don't know how long I'm gonna be on the job anymore, but, at least a year I'll be here for sure. And then after January, 2022, I might have to be replaced. So I'd like you to consider anybody who is considering getting involved in EMS. I think it's been great. I think we've done a great job with that new protocol, and Bruce has done an awesome job as chair. But I will serve as long as I'm needed. And you're right, I have been an advocate for EMS all my life.
Tom, this has been an odd year. We haven't really had a chance to really have a lot of in-person meetings, and we've been doing a lot of things virtually, and there's been kind of I guess a disconnect with all of us and getting together and stuff. If you'd be willing to serve that position, I haven't got any other takers at this point. If you would be willing to serve it until you feel like you need to leave, I would greatly, the committee would appreciate your service to that. So it sounds like you'd be willing to serve. And,
Yes.
I'd like to make that nomination. Does anybody have any other nominations that they would like to throw out there? Going once? Going twice? Nomination for vice chair. Gotta do it 3 times. Nominations for vice chair. So we're gonna close nominations. At this point, do I have a motion to close nominations?
Motion to close.
Thanks, Bob. Do we have a second?
Second.
Okay, David, thank you. Since we have only one person, and I'd like to go ahead and vote in vice chair position to Chief Mount of Brook Park. All in favor? Raise your hand. Aye.
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 Thank you. So we have a nominee, nominated choice here. Thank you, Tom, for serving and doing that role for us. And we'll take each step at a time. If you need to change or move forward, we'll do whatever it takes. But appreciate your service on this, and, doing this position for us.
All righty, thank you.
Sure. I was going to get a UASC update. This was actually on a report from last time because there were still uncertainties if we were going to be a UASC state or not, and our area we're not. So Cleveland didn't make the update. It's a UASC city. So Larry and Leslie reported on that. So scratch that. On to new announcements and miscellaneous business. Since we now have a quorum, I'd like to go back and approve the minutes of March 9th, 2020. I did send those out, and we're talking a year ago, but we have to go through this process and do things the right way. So if I can get a motion to approve the March 9th minutes, I would appreciate it.
Motion.
Okay, Bob.
Second.
Do I have a second? Anybody?
Second.
Okay. Good. Anybody choose not to approve these things? Speak now. If not, we'll consider them approved. All in favor? Good. So thank you for that. So we have those March 9th minutes approved. Again, November 9th of 2020 and January 11th of this year, there was no quorum, so there's nothing to approve for that. Does anybody have any announcements or miscellaneous business you'd like to discuss? Going once, twice? Okay. So our next meeting will be May 10th. I will be reaching out to the different regions to talk a little bit about participation and also dates and times. So right now we're tentatively set for May 10th, but that could change depending on the outcome of some of these discussions. So we'll just figure out May 10th for right now. And if there's no further business, I'd like to hear a motion for an adjournment.
Motion to adjourn.
Okay, Bob, thank you. Second?
Second, Mon.
Jackie, thank you, Jackie. All right, folks, we'll see you then.
Thanks,
you.
Bruce. Thank you.
Thanks a
All
lot.
right, thanks, Bruce. Have a good day.
Thank you, guys.
Bye, guys.